All righty. Good evening, everybody. My name is Tim Gibbs. I'm the Executive Director of the Delaware Academy of Medicine and the Delaware Public Health Association. And we are delighted to have you all joining us for Mini Medical School South. Traditionally, we've been doing this originating from Newcastle County, and we wanted to switch things up and make sure that we tap the talent and energy and made it available to all of you in Kent and Sussex counties. I believe that there are some people who are in this series who were just in the last series. So welcome back to all of you. And I'm going to go ahead and run through some slides here. Just this first slide of introduction here is you're participating in Fall 2023 South Delaware Mini Medical School. There are some QR codes there. You could do a screenshot or use your mobile device and grab those different social media sites. We would love it if you would like us and follow us and participate in an online dialogue. And also then, importantly, there's DelawareMiniMed.org. That's the website where you can go to learn more about the Delaware Youth Medical Academy, and where you can go about a week after each session and see the recording and download the PDF of the presentation. Also, we are truly delighted to be partnering with the Sussex County Health Coalition, and we'll be talking about that a little bit more in a while from one of their representatives. So let's move on to the next slide here. Again, here, the follow-on social. Just to tell you a little bit about the program. So the Academy's been around since 1930. MiniMed has been running continuously since 2009. And we've done, various tweaks over the years. We're really focused now on youth, middle school, junior, high school, undergrads. And for the adult learners in the group, we welcome you as well. Do appreciate that some of what you're going to hear is going to be very youth focused. As I mentioned, Sussex County Health Coalition is in partnership with us now. We are delighted for their partnership. And all of these sessions are being supported through the Delaware Health Force Initiative, which is a program of the Academy, DPHA. And it's supported by state and local fiscal recovery funds through the Department of Treasury in the state of Delaware. This is what's called ARPA, the American Rescue Plan Act. And this is what President Biden set up to help the country bounce back from the COVID-19 pandemic. Good news is no tests, no grades, yay. So you don't have to worry about that. This is the second of the two fall sessions occurring now, and you can attend multiple sessions. We encourage that you do, and there are perks for doing that. For any of the adult learners in the group, there is no continuing medical education for participating in MiniMed, no CE, no CME. Sorry if that's what you came for. This is not the right place, although for individual learning, it is the right place. Participants attending all 6 sessions, and it's essential, all 6, without fail, you will receive a certificate of achievement that will be signed by Dr. Kate Smith, by someone from Sussex County Health Coalition, and by myself. And that's a physical certificate. For people who only attend 5 or less or fewer sessions, you will be able to download a self-signed certificate, and we'll talk more about that later. So what are our goals here? We want to enhance health literacy in the community. We want you to learn more about how your body works. And importantly, we want to expose middle, junior, and high school and undergrad students to a range of topics and types of providers as part of career goal setting. For any of you who have been thinking about going into the life sciences, healthcare, research, this should help you on that path. And importantly, it may, for some of you, help you understand that this is not the path that you want to pursue, and that's a good outcome as well. So the presenters are going to be sharing their career pathways with the students to clarify, how they got to where they are today. I was originally pre-med. I didn't end up going to medical school, but mid-career, I went and got back my master's degree in public health. So that's just a little smattering of my, progress through my career. And also, we want to encourage dialogue through the Q&A between students and the instructors in a safe setting. Personal medical issues are not the focus of the discussion. The provider, the practitioner, the presenter is not going to be coming at you with a bad diagnosis or a needle for a flu shot or something like that. So this is a safe space. So I mentioned the Delaware Youth Medical Academy. This is new this year, and I'm proud to say that this idea came from Sussex County Health Coalition. So what we're doing here is we're going to incentivize participants to not only attend the courses, each of the 6 sessions in the series, but then advance, take another series and another. There are electronic badges. There will be some physical bling. We haven't quite figured out what that bling is going to be yet, but we might even do a little survey with you all to see what you would like. And ultimately, if you attend 3 sessions, you will be able to come as our guest to our annual meeting and be recognized. And we think that that might be fun for you. The big reason, however, to become a member of the Delaware Youth Medical Academy is it differentiates you from your peers. When you go to fill out college apps and whatnot, this will be one of those things that will make you different from the other person who otherwise has all the same accomplishments and grades and so on and so forth. A little bit of housekeeping tips. This is a Zoom webinar. You can't see or communicate with your fellow classmates. We're sorry, we tried it that way. It does not work well. Only use the Q&A feature to ask your questions. Don't ask questions of a personal or family nature. This is a violation of privacy rights, which we, the presenters and the Academy and Sussex County Health Coalition, have to take very seriously. All questions will be addressed, some by myself, others will be selected to be answered by the presenter at the end of their presentation. And importantly, we've asked the presenter to hold off on answering questions until the end of her presentation. You do need to stay through the entire presentation, but may leave when the Q&A part starts. But I'll tell you, a lot of good stuff comes up in the Q&A, so you might want to hang out and learn a little bit more there. Here's the fall semester. You all have seen this. We're going to start off with Julie Moyer-Knowles, understanding athletic training and physical therapy. And then we're going to go through some other topics and speakers. And I'll note that at the end of the series, you're going to hear another physical therapist talking about another part of how PT relates to and could be a career path for you. And at this point, I am going to turn it over to my friend and colleague, Christy, who will introduce this evening's speaker. Over to you, Christy.
Great, thanks, Tim. And I'm so excited to introduce Julie. Julie and I go back several years, and I actually worked for Julie, and I'm excited that she's here to talk about some of the work that she's done, because she has an amazing background. So I'm just going to read a little bit. Julie Moyer-Knowles is a businesswoman, a physical therapist, an athletic trainer. She's a voc rehab specialist and educator. She had a business for 25 years. And she sold that business, which was Southern Delaware Physical Therapy, to Pivot Health Systems. She continues to work for the organization while she's expanding her Knowles Enterprises, which is a healthcare property management company. She's been very active in the volunteer community. I remember that well about Julie and her family. They promote healthcare, including past and present appointments with some of these amazing organizations: the National Federation of High School Associations, the United States Olympic Sports Medicine Committee, Delaware Board of Professional Regulation for Physical Therapy and Athletic Training, University of Delaware Alumni Board, and the Delaware Interscholastic Athletic Association Sports Medicine Committee. She also continues educating within the athletic training, business, and physical therapy programs at University of Delaware and Thomas Jefferson University. Welcome, Julie. We're excited that you're here.
All right, I'm going to go ahead and stop share, and Christy, it's over to you to run the presentation.
Thank you, Christy. Thanks for inviting me tonight. Appreciate it. So, first of all, I am a physical therapist and an athletic trainer. So we're going to talk about both professions, what they are, what they're about, the types of patients they treat, and education-wise, what are different pathways you can go through to become a physical therapist, physical therapy assistant, or an athletic trainer. Now, I must say the pictures are not my own, so I do not profess to be a professional photographer. Please note I copied them off of other slides and presentations. And also some of the pictures may not be, may be a little yucky for some people. So if you tend to have an upset stomach when you see blood or yucky things, you may want to just listen to the presentation instead of watching the presentation. Christy, can you switch or can I switch? There we go. So to start off with, let's discuss what physical therapy is. Physical therapy is about motion. It's about movement. It's a treatment performed by a physical therapist or a physical therapy assistant that improves the motion and movement and physical function of people. It helps them manage their pain for acute and chronic conditions, and also helps prevent injury and disease. Next, please. Physical therapists, if you want to become a physical therapist, you will have to have your doctorate in physical therapy in a form of rehabilitation, and know that the emphasis is to examine, diagnose, treat movement dysfunctions. Again, that takes us all back to moving, getting people back to work, to life, to living. New graduate physical therapists do have their doctorate degree, so you must go through undergrad school, get your 4-year bachelor's degree, and then go on into physical therapy school. Next, please. Physical therapy assistants are associate degree holders, meaning you can go to places like Del Tech, get a 2-year degree in the physical therapy assistant program. Physical therapy assistants work under the supervision and the direction of the physical therapist. They do not work independent of physical therapists. Next, please. So let me tell you a little bit about the history, which I think is interesting and that you would enjoy hearing. Physical therapy started back in World War I. There were injured servicemen that the military was trying to get back into action. And they started a program called reconstruction aids that would reconstruct injured servicemen to get them back into war as fast as possible. Later, that program developed more, and they actually had college coursework, usually through college physical education programs or schools of gymnastics, as they were known back then. People would come out and have their certification as rehabilitation, reconstruction specialists. As time went on, after World War I, people thought, well, we don't need these type of individuals anymore. And then we wound up having the polio epidemic and World War II, which brought another onset and need of these reconstruction aids. The American Physical Therapy Association was first called the American Women's Physiotherapy Association because most people back then that were doing the reconstruction aid business were women. The men were the soldiers. I like to say that they lowered their standards later and let guys in and changed the name to American Physical Therapy Association. And now there's both men and women as physical therapists. But it did start out, when I started in the business, it started out as about 90% plus women. And now it's much more even than that. So from the beginning of time, when physical therapy was developed, we were known as people to promote motion, movement, and function, to get people back to work, back to the fields, the war fields, back to the workplace, back to everyday life and sports. Next, please. Now, you may have heard of physical therapists in the hospital. You may have heard of physical therapy in outpatient, but physical therapists do a lot more than what you may be familiar with. We work from the pediatric patient. There's neonatal physical therapists that work just on young babies born with disabilities to get them moving. There's physical therapists that work in the geriatric on the opposite end. There's cardiovascular physical therapists, so heart surgery, cabbage, coronary artery bypass graft, that they get the patients up, moving, functioning. Neurology, oncology is a big one, and the lymphedema that comes from radiation. Orthopedics, again, the more familiar one. Sports, also familiar. Women's health, and even skin, tegumentary system. Physical therapists are involved with that. One of my rotations in school was at Crozer-Chester Burn Center, and we had to submerge patients into big tanks, full-covered tanks, and actually debride the tissue that was dead skin, and get that dead skin off so that healing could occur. Because if you have burns with dead skin and you don't clean that off, blood supply can't get there and help with the healing process. One big thing with the body is you need blood to repair yourself. You need blood flow to help in the repair. If you don't have adequate blood flow, that tissue dies. So a lot of what we do in physical therapy is improve the blood flow to the muscles to help the muscles heal and improve. Blood flow to tissue, so that if you're diabetic, for example, and you have toes amputated, that we can get blood down to that area so that it can heal after the amputation. So a lot of what we do, again, promoting blood flow, which promotes healing, and motion. Next, please. PTs also work in a variety of settings. Again, you're probably familiar with the hospital and the outpatient or pediatric centers, but PT's very big in the military. And it's a great way to get a PT degree and become an officer and get your way paid through school. They really have a nice program. The other nice thing is, if there is ever a war, PTs aren't on the front line. They're back helping the injured servicemen get back to the war, the front. So it's a good way to help support the country, to get some free education and get a great career in physical therapy. Schools, we have physical therapists in schools for children with disabilities. We also have some in schools that do work some sports, but mainly that's athletic training, and I'll get into that a little bit later. Let me backtrack. In physical therapy, you can get a subspecialty in different fields, like pediatrics, like neurology, like cardiovascular. And sports is one of those specialties. However, it's not very cost effective for employers to send PTs as sports PTs to work on the field. So you don't always get that opportunity as just a PT to go on the field and work in the school setting. Nursing homes, you see PTs in nursing homes, and then home care, either through an agency or independent. This gal in this picture is a friend of mine. She is a PT, and her husband is an athletic trainer. They're both from Delaware. And years ago, they got fed up with all the snow. So they put everything they owned into their VW Bug, including their dogs, had chairs tied upside down on the roof, and headed south. They ended up in Key West, Florida, bought a boat that didn't float, a sailboat, double-masted Spanish mahogany sailboat, lived in the boatyard with these dogs, built a deck all around. And he did athletic training for the local school, and she did independent PT to the tourists that would come to Key West. So she was an independent contractor and would go out to people's homes. A lot of famous people would come to Key West, and a lot of people would fly her all over the world to do treatments on them when they weren't even in Key West. I've already gotten messages from her from Paris and Asia, where she was flown out to go treat one of her clients. So having this independent contract style lifestyle was wonderful for them. Again, they're that kind of people. They love that independence. They live on this boat that now floats. With these 7 dogs, they take their boat out and go diving for their lobster when they're hungry for lobster and take it back. So that type of independent contractor PT was a great lifestyle that they chose to do. Next, Christy, please. So what are the different career paths? If you see on the top, it has PTCAS directory.apta.org. You want to write that down. If you go there, they tell you all the different career paths, all the different requirements of all the different schools in the states that are accredited for both physical therapy and physical therapy assistant. So the apta.org website also has a sublink for students that goes into other details about physical therapy that you might find very interesting. Again, we talked previously that the PTA, two-year degree, and we have a fantastic program in Delaware with Del Tech. PT, you have to do undergraduate, meaning you get your 4-year degree somewhere, and then you go into the PT program. Next, please. To get into the PT program, and there are some different ones that accept you after 3 years, and we'll talk about those in a little bit. But you can pretty much as an undergrad major in anything that you want, so long as you take these 7 courses or 7 groups of courses. Most PT programs look at 2 different scores. They look at your overall GPA, and they look at your GPA in specific courses. Psych, stats, 2 general chemistries, 2 general bios. Delaware, I think it's 207 and 208, and chem was 103, 104. The physics, 2 physics, and these are all with labs, so they're all 4 credit courses. Human or mammalian anatomy with a lab, and human or mammalian physiology with a lab. And then there's some other schools that may require sociology or writing or neuroscience on the side. But these 7 categories, you can major in Spanish as long as you have these 7 categories met. You could apply to PT school. Next, please. So my big thing on undergrad, and this is just me, is I like to encourage people to major in a career. Don't major in a major. I know a young man that majored in English. And I said, well, what are you going to be when you grow up? An Englishman? What It what it wasn't scientific writing, it was English. There's a lot of money that goes into going to college. You want to make sure that if something comes up, if you get married and wind up having 7 kids before you graduate, or a family emergency, that you can't go on to graduate school as PT requires, that you have something to fall back on. Look at other options and see where they overlap that will allow you to get a good career if you choose to go down another path. For example, I looked at Widener's physician assistant program. The physician assistant program at Widener has the same 7 courses that are required for PT school, except one of the chemistries, instead of having 2 general chemistries, one has to be organic. And you have to add microbiology. Other than that, they're all the same. And the PA program is a master's. Again, you may go through undergrad and say, I can't go 3 more years for PT. I can only go 2. I have these other obligations. There's other things that you can possibly go into. Delaware nursing, same 7 courses, except one of the biologies is a microbiology, one of the chemistries is an organic chemistry, and no physics for those of you who don't like physics. But again, if you majored in nursing, you could always take at the end of 4 years and say, yes, now my spouse and 7 kids, I can now afford to go on and I want to be a PT. All you have to do then is take the physics courses and you can apply to PT school. So you want to see, again, I'm not a big one for pre-PT or pre-PA unless you get accepted as a freshman, and I'll go into that in a minute. I like to major in a career, but make sure you have all your bases covered. Take that extra winter session or summer session to get the courses that you need to apply to PT school then. Next, please. So some PT programs have what they call early acceptance. You have schools like Widener, where you can go 3 years as an undergrad and then apply, and then 3 years in the PT program. So at the end of 6 years, you have your doctorate in PT. There's programs like Messiah that when you apply as a freshman, they'll accept 24 students in their pre-PT early acceptance program, so that as long as you maintain a 3.0 GPA, including a B or better in those 7 main courses, and get your observation hours, your volunteer hours in PT, have good GRE scores, which are the graduate level scores similar to SAT, you're automatically in their PT program. This isn't that you do pre-PT and you don't know if you'll ever get into the PT program. This is you're guaranteed you're being early accepted into our doctoral PT program so long as you keep your grades up, which I really think is if you absolutely know you want to do PT, that's an excellent way to assure yourself a spot, so long as you have the grades and the drive to keep it up. Next, please. PTA programs on the left are the general requirements that the APTA has for students trying to get into the PTA programs in the schools. Del Tech, they have a PTA program which has competitive admissions. If you go to dtcc.edu, you can read more information about that. There's some courses that you take, and then you can apply to get into the actual PTA program. They also have a really good. Del Tech has a really good healthcare program. They have paramedic training, they have nursing, they have sonography, all of which you can start out in and then go and finish your bachelor's degree somewhere and then go on to PT school. But at least you have a career when you're done at Del Tech. I like the Del Tech Newman College connection. Newman College has a program where they help bridge undergraduates that have athletic training undergraduate degree or some other degree from Del Tech, like PT assistant. And you take these weekend courses while you're working as a PTA. You can go up there and take weekend courses and then apply for their PT program once you have your bachelor's and get in their PT program. And again, have weekend courses to complete your PT degree, which is really good for those of you who have to work your way through school. It's a great opportunity. Next, please, Chrissy. So let me tell you a little bit about myself now that I went into all of this. I went to UD for physical therapy and athletic training. I wanted to go to a university back in the day, I won't tell you how many years ago, that had both a major in physical therapy and athletic training, and Delaware was one of only 16 schools at the time that had such. I was originally from Berks County, Pennsylvania, and came to Delaware for that reason. I also wanted to combine, back then, sports medicine wasn't a big thing, and I wanted to learn more about sports injuries and orthopedic injuries and kind of combine those two. I was fortunate to work with different types of clients through my career. I worked with high school athletes, collegiate, professional athletes, again, with my specialty being more orthopedic and sports, physical therapy and athletic training. I've been a member of the U.S. Olympic Committee and Olympic teams, treated many Olympians, worked with military personnel, politicians, famous people, governors, legislators, presidential staff, TV personalities, but most important, it is everybody that walks in the door, even without a title. You know, I was raised that I'm no better or worse than anybody else on the planet. And so I really enjoy treating all types, even the non-ortho sports, because you're helping people and you really feel good when you can. Well, when I was, I'll give you an example. When I was going with the Olympics the first time, I had to work part-time for Christiana Care because working with the Olympics, you have to tour with teams at a time. I was touring with teams for about 3 months, working for the Olympic Committee before the Olympic Games, getting them in the same time zone because they have to train in the same time zone. For example, in Korea, you don't want to be 15, 16 hours away from what you're used to training and competing in. So a lot of people work their way over to Australia and trained in Australia or Japan before the Korean Games. Same thing with when the Olympic Games were in China. You want to get as close to that time zone as possible, training with your teams. But back to the story, I worked for Christiana Care when I was back in town, and I would go wherever they needed me. And one of those places was their rehab hospital. So I got to work with strokes and amputees. And I was very fulfilled with that. When you can take somebody that's amputated below the knee and help them walk again, it's extremely rewarding. Or take a stroke patient who one side of their body is paralyzed and get them up walking with a cane. It's a very, very, very rewarding career. And even the burn patient that I showed you the picture of earlier, that's a hard one because they're in a lot of pain and discomfort when you're doing that, but it's helping them. It's helping their healing, helping them not to get an infection, and eventually making them a lot more functional so that they don't tighten up from all their burns. So all these different fields, even though I'm ortho sports, all the different fields are very, very rewarding. All the different people, very rewarding. So let's take a little look at this picture. Christy, can you blow in on that knee so that we can kind of see? And can you see the injury there, guys? I don't know that that can be blown up anymore. But look at his right knee and see how smooth that is with the kneecap. And look at the left knee. Where'd the kneecap go? I did have one gal one year at the University of Delaware that was a basketball player. Went up for a layup, no contact at all. Came down, grabbed her leg like that. And when I ran out there, her patella or kneecap was halfway up her thigh. The patellar tendon had snapped and the patella recoiled all the way up into the thigh. Now, what they do for that then is they obviously need surgery. They need to find that patella and bring it back down and screw it back in the tibial tubercle, the bump on the top of the shin bone, to get it back into place. Therapy wise, it is a rough rehab because after surgery, you have to have your leg straight for so long. It's very stiff and very hard. And as therapists, we got to work on bending it to get them back to normal function. Okay, next one, please. Now, like I said, besides physical therapy, I'm also an athletic trainer. Athletic training used to be a 4-year degree. It is now a master's level degree. Athletic trainers are essential in our healthcare system. They are essential in sports. They prevent, evaluate, treat, and rehabilitate athletic and other musculoskeletal disorders. Good news. We'll keep our fingers crossed. Delaware may be a leader in this nationally. We're trying to get 2024 that there is a full-time athletic trainer in every high school. That is mandatory, and that is a law that's hopefully going to be passed in this January. Delaware leading the nation. Again, recognizing that the athletic trainers there to treat musculoskeletal disorders, concussions, diabetics, playing sports, all sorts of things. Helping with pain management after an injury so that there's not opioid abuse, helping with mental health issues. There's a lot of athletic trainers in Delaware were COVID point people in their schools when COVID was going on. So they're a great, in my opinion, invaluable resource to use in the schools. Next, please. NATA.org is the National Association for Athletic Trainers. That is where you too can go, click on students, get more information, find out all the schools that offer athletic training. Now, Delaware, they're a master's degree. All nationwide, all the programs are master's degree. So it's a little bit harder to go from athletic training right to PT. It adds maybe a year to your total education. But there's schools that are cropping up now that have 3+3 programs. That they have a way that you can go, or even 4+2, with part of the 4 being under athletic training courses and PT courses that overlap. For example, University of Lynchburg, I highly suggest you look them up and see how you can go and do both athletic training and PT at the same time. I mentioned earlier about some specialties in physical therapy, one of them being sports PT. You go, it's about 2 years after you've been out for 2 years, and you have to have hours, and there's different residencies you can do to become a sports PT specialist. However, many of the pro teams require you to be a PTAT and not just a sports PT to work for the pros. There's two fellows, colleagues of mine. One was a PT, and I'm very involved with Blue Gold, the FRC, Blue Gold. And we take a lot of the UD sports PT residents to help work the Blue Gold camp. He was one of those, and his goal was to become a professional, a PT for a professional sports team. And I said, if you really want to do that, you got to go back for athletic training. You really got to combine the two. They don't just look at the sports PT. He is now, is he with the Jets or New England Patriots? I'm not sure. It's not the Eagles, so it doesn't matter. No. But he's with one of those teams now. He went back and he got his athletic training after he had his doctorate in PT and his sports PT residency. There's another young man who is with Miami Dolphins. He was an athletic trainer. He's from Milford. Great young man, Jonathan Boone. You can look up his name. He was an athletic trainer, went back and went to the school in Florida, St. Augustine's program, and got his PT degree. And now he's the director of sports rehab with Miami Dolphins. Again, AT and PT combo. So if your desire is really to work with the elite athlete, the pro, the Olympian, I suggest that you do AT-PT combo, if possible. Next, please. So by combining both of them, you get athletic training does a lot more acute care on the field, how to manage the emergencies. You don't get that as much in the sports PT end. You get more of the rehabilitation after the injury has occurred, trying to get them back on the field. And it's really important to know both if you're covering sports. For example, bottom left, pair skating. Pair skating is, which Delaware used to be the largest training ground for pair skating in the world. I don't know if it still is, but you're so tight with your partner and the blades are so sharp. There are some serious blade injuries that occur in that sport. If somebody goes down and they're bleeding profusely, you want the training, which you get more in athletic training than you really don't get that in PT, to treat that type of emergency on the ice. Or maybe an injury like the one on the bottom right, where there's an acute fracture. Now, obviously, that has to be both bones in the lower leg, tibia and fibula. In PT, we would know how to rehabilitate that, but athletic training teaches us how to deal with it in the ring. Next, please. There's another good one for you. Tib-fib fracture on the left. The right, actually, a friend of mine was there. We said about the blades and skates being dangerous. Here's one that severed at the neck. This could have been a life or death situation if it wasn't handled properly. Okay, so in all, athletic trainers do more acute care, initial management, and they do some rehab. PTs can do some initial care, some initial management, but they do more rehab. So if you really want to be involved in sports medicine from a therapist perspective, think of combining both and doing it in a way that it can be a functional step for you career-wise, doing athletic training or nursing to PT. Okay, can we open it up for some questions? Christy, how would you like to do this?
Thank you very much. So at this point, if any of the student members, and here Madison has just asked a question, just go ahead and drop your questions into the Q&A. Madison asked, so overall, how much schooling do you have to go through to become a PTA?
Good question, Madison. A PTA is a 2-year program. Caltech has a 2-year program, and I would plan on actually 2.5 if you don't go year round. You really don't. There's courses you have to take before you get into the program. So I would suggest that you go work either through the summer to get those extra courses or plan on 2.5 years, even though they say it's an associate's degree program.
Hey, what sport do you see the most injury in?
Are we talking like high school sports?
Sure.
Okay.
Let's go high school.
High school sports are divided into 3 categories: collision, contact, and non-contact. Your collision sports are football, men's basketball, wrestling, and lacrosse. The DIAA right now is contemplating requiring a full-time athletic trainer at every collision sport event. Once the new law passes, there's going to be more requirements. But for right now, we're looking for football, again, high injury rate, wrestling, men's basketball, and men's lacrosse. Now, that doesn't mean that other injuries don't occur in contact sports. You have men's and women's soccer that have a high number of concussions. You have women's basketball, women's lacrosse, softball, and baseball. And then you have your non-contacts, your track and field, your tennis, your golf, swimming, and diving. But usually you see more in the collision sports. At the Olympic level, there's a difference between frequency and severity. Okay, so you can see severe injuries in things like pentathlon, equestrian, because of the head and body injuries that you can get working with animals in the horses. But you can get frequent injuries in other sports like track and field. You can get a lot of little injuries. So it all depends on if you're looking at frequency or severity at that level.
All right. Somebody says, I plan on becoming a PA. Great. Is it a good idea to get patient care hours and experience in a PT clinic? If so, do I need to have any certifications to do that?
Most PA schools are like most PT schools. They require 3 letters of recommendation. At least 2 of the 3 should be from a PA. So as many hours as you can under that PA would be advisable. So if you're going to if you're applying to PT school, you want to get observation hours, at least between 50 and 100 in most cases, depending on the school. But your letters of recommendation usually are 3, 2 within your program, and 1 can be any other person outside your major.
Okay. So this is a great question. If there is a situation where you're on a medical pathway track, such as to be a physical therapist, and you decide it's not for you, can you continue in a different pathway? Can you shift tracks?
Wonderful question. And that's exactly why I added that slide about those 7 courses, right? Those 7 courses are your main courses that you have to get in for PA school, PT school. It can cover you for athletic training. It can cover you for nursing. So those 7 core courses allow you to go in many different fields. You could wind up being a science teacher in high school. So there's many different paths then that you can do as long as you take those 7 core course tracks. If you don't, you'll have to at some time to apply to any of the healthcare majors. Those healthcare majors pretty much require 2 bios, 2 chems, anatomy, physiology, statistics, a psych course. Some require a social course. And then, of course, PT requires the physics.
All right.
Which, as a hint, I would take summer school or winter session. Then you take the course in the lab, only that, nothing else. you get the physics done with.
All right, and since you just mentioned anatomy and physiology, drilling down, what knowledge from anatomy and physiology do you mainly use in physical therapy?
It's everything. It is everything. It's like, if you don't know what streets are, how do you know how to read a map? You know, it is the fundamental. Let me show you. If I want to teach somebody to move their wrist, I have to know what muscles go from here to here. It's like a string from here to here. When I pull the string, the wrist goes down. When I pull the string in the back, the wrist comes back like a puppet. If I don't know where that string starts and where that string ends, I can't determine the movement. I have to know my anatomy to determine that motion. And everything about PT is motion.
All right. How many years is needed to take a combined PT, AT?
Combined?
Word combined.
It depends. If you can get into, like, you want to look at that Lynchburg program, and more are coming that way, that they have a 3+, they have it that in 6 years instead of 7, you can get the combination. You can get both the athletic training and the PT. Again, I really like that if you're into sports and ortho. If you're not, and you still want to be a PT, I still advise an undergrad degree in something other than pre-PT, unless you get accepted in as a freshman in that early acceptance program. If you can get in as a freshman, and then it's on you, right? You keep your grades up, you're in, you're going to be a PT. If you're not in as a freshman, it's a worry. It's a lot of stress. What do I do after 4 years if I don't get into PT school? Then you better make sure that you're not majoring in English and become an Englishman at the end of 4 years. Major in a career, don't major in a major.
Right. That is excellent advice with which I strongly agree. Can physical therapy prevent or minimize future arthritis or osteoporosis?
Sometimes. I mean, if you read the books, they'll say, yes, we can do everything. But in all honesty, if you're predisposed to you have a bad family history, you're going to get it. We may be able to help delay it. Weight-bearing activities tend to help those with osteoporosis. They help keep your bones strong. They help delay the onset of osteoporosis. Too much pounding can cause wear on the joints, which is arthritis. Arthro meaning joint, and itis is inflammation of. So you go one extreme to another. You do a whole lot of pounding, you get arthritis. You have weak bones, you don't absorb calcium. Just to simplify it, you don't absorb the calcium that you should in your bone to keep your bones strong. They become weak and break down. Weight-bearing exercise can help with that.
All right. Boy, so many questions. Good class. Good class. Christy, you ask one.
Why did you become a physical therapist?
Well, interesting. My family was involved with rehab hospitals. They all worked at a place called, back in the day, it was a Reading Rehab Hospital. A lot of strokes, amputees. I got to walk in and out and see a lot of people being helped there. And when I was younger, in 10th grade, I hit my head during a basketball game and was knocked out and woke up in ICU. Couldn't move my left side and wound up getting rehabilitated. And but it seemed to me, now I'm an old people, and I'm saying this, it was old people rehab. They didn't have anything youthful and exciting, and I was young, so I wanted to do something that to kind of combine my love for sports and rehabilitation. And that's when I start looking at both PT and AT. There was not sports medicine per se back in the 70s. That's how old I am. When I finally got my doctorate, I think there was 11 of us in the country with our PT, ATC, and doctorate. So it was very young. But I was inspired by my family and where they worked and going through it myself.
All right. I'm going to paraphrase this question from Emily just a little bit. Emily is planning on joining the armed forces,
Right.
and still trying to figure out which branch would be best for her to advance medical field, not only with injured soldiers, but also with veterans.
I'm not a military expert, so let me preface the answer with that. But I believe no matter what branch you're in, you can work in the VA. You're not limited by branch. I would, I would say it just depends on you. I have a friend that wanted to become a physician, and she was a personal trainer, had her master's in exercise science from Delaware, joined the Navy, and went to med school and served she became a family physician with the Navy and now works in Southern Delaware. So I can't help you with the branch. I would say whichever one gives you the best deal for PT school. The main PT school that I'm familiar with is in Texas with the military, and I believe it's Air Force, but that doesn't mean that the other branches don't have good programs as well. But you may want to check that one out in Texas.
Righty. Adeline, I'm going to answer a question myself. Adeline asks, how many years to become a gynecologist or a dermatologist? In other words, a medical specialist. Generally, at least 12 years of school, because you go to medical school, you do your residency, and then you do a fellowship. So it takes a different level of dedication to get into a high level of specialization like that. Let's see. Sydney asks, what high school classes would you try and focus on before going to college? Are they the same as what I would want to take in college? So for instance, if you wanted to be career-minded and go into biology as a career, what should you be taking in high school?
You want to, I'm not sure I understand that. Biology as a career,
Well, what the question was, what courses should high school students be taking relative to what courses they're going to be taking in undergrad? I guess that's another way to ask the question.
Okay. If you go to that one website that I told you that has all the schools, the PT schools, and it also tells you about your AP courses and which ones, when you go into the specific school, it'll tell you your AP courses and which ones accept those as part of that group of 7. But I would think of the group of 7 as where you should focus: stats, bio, chem, physics, especially bio and chem, because the PA schools require bio and chem. The nursing schools require bio and chem, right? The other programs that you may go besides PT are always bio and chem. Then physics is more specific to PT. And anatomy you can take before you're an official freshman if you want. There's things that you can take that are a lot of studying and a lot of memorization. Anatomy is one of those that you could take some courses before you go into school, or in the summers between freshman and sophomore year, between sophomore and junior year.
All right.
I want to ask this one. Can we ask the anonymous says, when you showed the leg injury in the MMA fight, what exactly happened?
I believe that was a kick gone bad.
Yeah.
Depending on the angle that you kick, you can fracture yourself that way. Unfortunately.
All right, Christy, you grab another one.
Let's look.
Let me go back to the MMA. The fibula is a smaller, the bump on the outside of the ankle is the fibula. That's the bone, a smaller bone. The shin bone is the bump that goes to the inside of the ankle. The shin bone pretty strong. It takes a lot of force to break that. The fibula doesn't take as much force. We actually, at one of the Olympic Games, we had a middle distance runner at the Olympics that wound up had a stress fracture in his fibula. And it was horrible. He finally made it to the Olympics. He worked his entire life to make it to the Olympics. All he wanted to do was run. So we tried everything that we could, and he got out there, and we had to explain, you know, if you keep running, this thing could snap in half. You could break an artery, a nerve, you could have permanent injury. And he said, I don't care. I've trained my whole life for this. Do what you can. And we figured stuff out and got him back running.
Paulina asked, have you enjoyed your time as a PT athletic trainer? What's been your favorite part of your experiences?
Well, the Olympics is fun, you know, that we got to march out in opening ceremonies in the tunnel, you know, treat athletes, meet people from all over the world, you know, working with the Olympians and training with them. Got to meet other countries. We usually, the English speaking countries team up together so that, you know, if you need supplies or something, you can help each other out. You hang out with the French afterwards because they have good wine after the games are over. I don't go into any more of that. But from a career, that was probably the most fun that I've had. But every day's fun. I really love what I do, you know, so, or I wouldn't be doing it.
All right.
We have a lot of questions.
This is great. All right, so Allison asked a good question, sort of the other side of things. What are some of the downsides of being a PT, if there are any?
If you work an outpatient, you got to work usually at least 2 nights a week. Some people don't like that. They want to be home with their family. But that beats athletic training, where you know, if you're an athletic trainer, if you're actually in the sports, you start in the afternoon when the kids are out of school. You're working every weekend. It's really hard to have a life and to be a good parent. I remember running out on the football field with my daughter on my back in a pouch, you know, to treat an athlete on the football field. So that the time and energy that goes in to sports ortho is tough. But let me say this, there's other fields in physical therapy that don't require that time commitment. You could work in peds in the schools and work school hours. You could do home care and make up your own hours. Or you could be like Stacy in the picture that I showed you, and she works whenever she wants to and sits on the beach in Key West whenever the other time, you know? So it's more things that I have done. You know, the downside is more the timing based on the field that I'd like within physical therapy.
All right. Gabrielle, I'll take your question. Would a Spanish minor or Spanish in healthcare minor help you in the field? My answer to you is absolutely. We need more providers of all types, nurses, doctors, PTs, ATs, dental hygienists who are multilingual. It makes it much easier for patients for communication. It can be very rewarding. So please, if Spanish is your native language, or you've already got a good leg up on it, keep going. We need you.
I think at the very beginning, we had a question. Can you serve as a PT in the military without going ahead to have a PT career?
No. No, you have to be a PT, you must be a licensed PT. You must be a PT. Now, they do have something called kinesiologists that only, as far as I know, only the VA system uses. They work mainly in the rehab field. Usually the people that have those are 4-year, have a degree in kinesiology, biomechanics or kinesiology, 4-year degree. But no, if you're going to be a PT, you have to have gone through a PT program.
I think we have a couple questions similar. Is there anywhere that someone can volunteer to get in-person experience to make sure PT is for them?
Yeah, most outpatient. I work right now. I'm working with Pivot Physical Therapy throughout the state, ATIs throughout the state, Premier Physical Therapy, Christiana Care, St. Francis. Rise. You know, there's a lot of physical therapy places that take volunteers.
All righty. One housekeeping thing that I just realized I didn't let you all know of in advance. Please send, if you're logged on by your telephone, please send an email to, I'll put it in the chat. Somebody out there asked the question, Tim, what is your email address? And I'll answer it publicly, tgibbs@delamed.org. And everyone needs to send me an email if you are just calling in and not actually logged into the Zoom session. I'm sorry, I completely forgot about that.
May I answer a couple that I see here? One,
go for it.
Something about size. One of the best therapists that I saw working with a stroke patient was just this tiny little gal. First name Sandy. She was probably, I don't know if she was 5 foot, but she could totally handle a stroke patient, which has a lot of, they tend to be harder, heavier, leaning to one side. So if you're small, if you're not the tallest person, I would not worry about that a bit. I would still get involved in physical therapy. And as far as career paths with the criminal justice system, the only ones that I'm familiar with are like the state police have the flight nurses. And Tim, I don't know if you know more than that work directly with criminal justice, but there are flight nurses that you go through, you get your nursing degree, but then you also apply to the state police and wear both hats.
I believe paramedic school, they can also do flight stuff. And
okay.
Yeah. Mm-hmm.
And Deltec does have paramedic school.
Correct.
What all does the University of Delaware have, Julia?
Delaware they have nursing at the bachelor's level. They have a speech pathology track. They have an OT track that's teamed with Jefferson, I believe. Of course, the PT program that has continually ranked top in the nation for years, which is good and bad, right? It means it's that much harder to get in, even if you're a Delawarean, for the in-state tuition, but it's a mighty fine program. And that's another place to volunteer, guys. The STAR campus at University of Delaware, they have speech, PT, OT, nursing, a lot of different programs that you could go there and volunteer and get some hours.
Do you know the answer, Julie, to the question, are teens ages like us, 15 to 16, allowed to volunteer or work in medical hospital or somewhere to have experience? If so, where would you recommend?
I had a 16-year-old working with me that went to school part-time at a tech school downstate. And we had to follow Delaware labor laws and how many hours and what days, and how to do the HIPAA training, because that's important. Everybody's personal health information is confidential, and we have to, review that. But it's very doable.
Okay, and I'm just going to respond live to a couple of things. Another question about volunteering, and I'll do some research on that. The question was, is there anything required to volunteer for programs at hospitals, especially for teens like Christiana Care? I'll do a little bit of digging on that, and I'll send an email out to everybody and see what we find out. I did volunteer work at New Moors way back when, maybe in the 70s, when I was a high school student. So let's just say that a lot has changed since then. So I want to be up to date on it. Have there been any situations where you felt as though you had to reflect on why you chose to be a PT?
Actually not. I mean, once I had my mindset, that was it. That was it.
Right.
Back in my day, you have to understand, if you wanted to be an MD, your life was MD. It was hard to have a family. And I was a female, and I wanted a family at some point. I did not want my life just being my job. So instead of medical school, which was one of the things going in my head at that time, I decided on physical therapy school. But today, as a MD, you have those options to limit your hours. So even if you're a female with a family, you have that capability. But back then I didn't, so once I decided it was PT, it was PT, that was it. One way or another, I was going to be a PT.
Okay. Is physical therapy a temporary solution or a permanent fix?
Permanent fix. If we do our job right, it is a permanent fix. We help you help yourself. If we help you move, I'll give you an example. My husband had a total hip replacement 6 days ago. He was walking with a cane less than 72 hours post-op. I can steer him. I can tell him what to do. I can teach him and show him. He has to do it. So we motivate the patient and they do it to make it permanent. What we do is temporary. What we hope to do is make it permanent within themselves.
All righty. To the person who asked if there's summer programs for students interested in PT, there are, and what I would encourage you to do is to actually Google that question, and it will give you a pretty extensive list. It does not look like there's anything in Delaware at this point, nothing that's coming up in the results. But in any event, perhaps Julie, do you know if there are any?
A lot of clinics will take volunteers in the summer. We
great.
We get a lot of volunteers in the summer. Yep. And again, like you said, you were looking into it for Christiana. Some might require your immunization record or something like that to be inside a hospital. We in most outpatient clinics, just need the proper HIPAA training and confidentiality training and observation hour form. And most clinics that I know accept students all summer.
All right.
Now,
Julie, go ahead.
If I can just suggest though, if you're going to do it right. We've had students that wanted to volunteer, and this is down at the beach. Then they decided it was too sunny of a day, so they were calling out every Friday. That's not a good way to start your career. And that's what you're doing in essence. When you're volunteering, you're starting your career. So treat it as a job and stick to it.
Great advice.
Yeah.
If someone was interested in PT and AT, which would you say to start with? Then would you work towards the other option?
Okay. I would start with AT, but I would take the courses that are required also for PT school. So your elective isn't going to be basket weaving 101 like Ohio State football, you know. I didn't say that, did I? Go Penn State. Your class, your elective is going to be physiology, human physiology, or something that a higher level of physiology than perhaps you would have as an athletic trainer, or physics that you don't need in athletic training.
Have you ever witnessed someone further injuring themselves during PT?
Knock on wood, I have not.
It's good.
It can happen. You know, sometimes it's walking a tightrope. What you're trying to do is as much as you can at a certain stage of healing. And then you got to wait for biology to take you to the next level, and then do as much as you can up to the next stage of healing. And some people may heal a little slower than others. So you really have to listen to the patient and adjust. But no, I haven't had that. Thank goodness.
Gabrielle asked, how much schooling would it take to get the PT-AT combo? Is it easy to enter the field with a different previously acquired degree?
Well, the AT is a master's, and there's courses that you need to get to have taken before you get into the AT master's program. If you have taken those courses, then it's not difficult. If you haven't taken those courses, you know, 2 biologies with labs, 2 chems with lab, 2 physics with lab, A&P, you know, stats, that could take a good year or a year and a half for you to get all those, to be able to even apply.
Oh, we're whittling it down. We've got 2 left, Christy.
I know. We have Emily. Let's see. At my school, we do work-based learning, and I plan on doing Pivot. What are the advantages behind them, and would it be a good place to start my training as a PT?
I love the company. It's an Athletico company based out of Chicago. I think they have good ethics, which is huge for me. There's an old saying that Christy will remember: you can't do the right things wrong or the wrong things right. You have to do the right things right. That was something my father always said. And I think that company does the right things right. Of course, you know, there could be some outliers here and there that you hear bad stories like anywhere, but I think overall it's a good company. Would it be a good place to start your career? Yes, if you are into outpatient physical therapy. If that's not your thing, if you find through your training that you like acute care or rehab or pediatrics, then no, then go somewhere else. If you have no idea where you want to start, I suggest starting in the hospital at acute care, because at least you get that out of the way. At least you get all the bad stuff out of the way. Like if you can treat somebody that has a tube hanging out of every orifice, or that has a terrible burn smell, or if you can treat those acute disorders, you can go anywhere and be okay. So if you don't know what area you'd like, do the acute care and find yourself, and then go on. If you know you like outpatient, then yes, Pivot's a great place to work.
All righty. We're
Okay.
getting down
Let's
to
do
the
one
end
more.
here. Yeah. What are your thoughts on the Allied Health Senior Only Sports Medicine Program? Do you think that it is beneficial? I don't even know what that is.
I don't either. I don't know what a senior only sports medicine program is.
Yeah. Afraid we can't help you there, but that's one of the things that you will definitely find through many medical school. If we don't know the answer, we will let you know. I'll see what research I can do on that. Well, Julie, thank you very, very much for presenting this evening. Next week, it's going to be From Nurse to Family Nurse Practitioner, Helping Communities Navigate Complicated Health Systems, presented by Dr. Carrie Snyder. So we look forward to seeing you next week. And thank you all for attending. Have a great evening. Bye-bye.